Hi, I'm Dr. Joe Childs. I'm a board-certified chiropractic neurologist. On this DVD today, I want to talk to you about early Alzheimer's disease. I want to talk to you about an alternative treatment source that you can add to the treatments that you're currently doing if you've been diagnosed with Alzheimer's disease. If you've been diagnosed with Alzheimer's disease, I'm sure you're very concerned about how your future looks. And today what we're going to talk about is we're going to talk about some of the things that we do in our early Alzheimer's program, our drug-free early Alzheimer's program, so you can help prevent and so you can keep your brain functioning at its best as you go through this process. So before we get talking about Alzheimer's disease, what I'd like to do is tell you a little bit about myself. Again, I'm a board-certified chiropractic neurologist. And basically what a chiropractic neurologist is just like there's medical neurologists and there's medical orthopedists and medical internists, in chiropractic you can also specialize. And I chose to specialize in chiropractic neurology. I chose to continue my education and take the required board for the chiropractic neurology program. And the difference between a chiropractic neurologist and a medical neurologist is a medical neurologist treats with drugs and surgery, whereas a chiropractic neurologist treats with specific types of nutritional care, metabolic care, and neurological brain-based stimulations to keep the brain functioning as well as it possibly can be. So we're going to talk about that today. Again, I'm also fellowship trained in functional neurology. Functional neurology is defined as drugless neurology. I've also been fellowship trained in child neurodevelopmental disorders. So not only do we see seniors with Alzheimer's and all types of other chronic conditions, we also see kids with neurodevelopmental disorders like ADD and ADHD. I'm also trained in functional nutrition. Functional nutrition is taking specific blood panels and giving you specific nutritional recommendations based on specific lab tests. I'm also trained in spinal decompression therapy and spinal biomechanics. And prior to me being a chiropractor, I've been a chiropractor, chiropractic neurologist now in Downingtown here for the last 12 years, going on 12 years. I was an exercise physiologist. So that's a little bit about my qualifications. And what I'm going to do today is talk to you a little about Alzheimer's disease. Alzheimer's disease is a progressive brain disease that slowly destroys your memory, your ability to think, and as it gets really bad, it can destroy all functions. So it's a very serious disease, as you know. The big goal is to prevent. We're going to talk about that. A couple things that we see in Alzheimer's disease. We see neuronal cell death. That means the neurons are actually dying. We also see neurofibril tangles, which means the neurons kind of get tangled up in what we call an amyloid plaque. Amyloid plaques is like a protein deposit that starts to develop into your brain. So we're going to talk about that a little bit more detail. The damage begins in the temporal lobe, which is this lobe right here. The temporal lobe is important for not only smell and hearing, but it's also important for memory. And that's where the damage begins. That's where we start to see neuronal cell death and we see the amyloid plaques. And then what happens as it progresses, the damage is going to spread to all brain areas, causing your brain to shrink. So when you look at a brain of a patient with Alzheimer's disease, the brain actually shrinks. It actually gets smaller because of the neuronal cell death and all the different plaques that develop in the brain. The causes of Alzheimer's disease, well, genetics plays a role, obviously. So there's people that are more predisposed to this problem. So if you have a father, you've had a grandfather, or somebody in your family that's older than you, and they have Alzheimer's disease, there's a high likelihood that you're going to have Alzheimer's disease. But it's not just genetics. It's also lifestyle, it's environment, and there's unknown factors. And usually those unknown factors are something in the environment that could be causing it. Okay, so things aren't purely genetic, and we're going to talk about that as we go. I want you to understand that genetics load the gun, and lifestyle and the environment pulls the trigger. So let's say you have the genetics to have Alzheimer's disease, or the genetics for breast cancer, or something of that nature, and your environment or your lifestyle is very poor, and you have a lot of metabolic problems and things like that. You're going to express those genes. Those genes are going to come online much faster if the environment pulls the trigger. Does that make sense to you? I want you to understand that. You have a lot of control, or a lot more control than you think, over your health, especially your brain health. A couple different Alzheimer's drugs. They use cholinesterase inhibitors. acetylcholine is an important neurotransmitter in the temporal lobe and for memory. So you have an enzyme that comes in and it destroys or takes away the acetylcholine when it's in the neurons. Well, what happens when that acetylcholine esterase comes in, it removes the acetylcholine. So if they can inhibit the enzyme that removes it, it's going to help you with memory. And then they also have something called glutamate regulators. And glutamate, when you've got too much of this neurotransmitter in your brain, it can cause brain cell death. And so they have these regulators. These are Alzheimer's drugs. They don't completely stop the disease, but they can be very helpful. And again, I'm not against these medications at all. A couple things about Alzheimer's disease is prevention is the key. This has been studied. The damage that you see in your brain due to Alzheimer's disease begins 10 to 20 years before you have any symptoms, before you start being forgetful or you find yourself having a hard time finding your car in the parking lot, and it's happening consistently. 10 to 20 years before that, the damage is already there. Okay, so prevention is the key. All right. Here's the interesting thing. 7% of people over age 65 are going to have Alzheimer's disease, and 40% of people over age 80 will develop Alzheimer's disease. So this is a big epidemic. This is really, really starting to affect our healthcare system as a whole. And Alzheimer's is the most common form of dementia. There's other forms of dementia. You can have dementia from Parkinson's. You can have dementia from a stroke. But Alzheimer's, the disease of Alzheimer's, is the #1 reason why people develop dementia. So our goals of care, and we're going to talk about this in detail, is again, prevention is the key. We want to slow down the process of the disease, and we want to create what's called neuroplasticity. Neuroplasticity means that we can stimulate the brain. If we get the metabolic environment and we do specific stimulations of the brain, the more you use the brain can actually develop better synapses and stronger nerve cells if it's being stimulated. So that's what neuroplasticity is. And you need to continually try to create that if you're going to prevent the downward spiral of Alzheimer's disease. A couple more key points. We're not against you using medications. Now, the medications obviously have side effects. And of course you want to reduce your need for those as much as possible, but people that do our program can still be on the medications that their medical neurologist is giving them. So we're not against you taking medications, but you need to do all you can to maintain your brain function. So if all you're doing is the medications, but you're doing nothing alternatively, or you're doing nothing to affect your neurons and your metabolic system from a natural perspective, then you're not doing all you can to make this process go as slow as possible and maybe even reverse some of the process through neuroplasticity. A couple key points. We do not treat late-stage Alzheimer's disease. So we don't treat patients that have had Alzheimer's disease for many, many years and they're very incoherent, they've lost their function, they may have lost bowel or bladder function. These kind of patients are kind of past the point for natural type care. But what we do treat is early stage Alzheimer's disease. If you've been just diagnosed, or you've had it for a few years, or you know that somebody in your family has it, and so you know you've got a strong genetic possibility of developing it, then we do treat that type of person. So again, we don't treat late stage, just early stage Alzheimer's disease. So what makes us different from every other doctor you've seen? That's a big question. What makes us different? Well, we're going to talk to you about that today. We treat Alzheimer's disease metabolically and neurologically. That's very important. The left-hand side, metabolic and neurologic. And we're going to tell you about what exactly that is. Your nerves and your brain requires two things to survive and to function properly. It requires fuel and it requires activation or stimulation. Fuel is in the form of glucose, which comes from your metabolism and how well your insides are functioning. And oxygen comes from the air we breathe. Well, as we age, we reduce our ability to utilize oxygen by 1% per year after age 25. So as we age, we decrease our brain's ability to get oxygen, and that's very important. So we have to do fuel. Now, fuel is the metabolic side. Remember, we said we treat it metabolically and neurologically. Activation are specific brain stimulations and brain rehabilitation we can use to target specific areas of your brain that may not be functioning very well due to autism. Okay? Not autism, rather, Alzheimer's disease. So we leave no stone unturned in your Alzheimer's care. I want you to understand that. If you're watching this video right now, it's either you or more likely somebody you love who is watching this video right now and they're looking for some answers. Well, I want you to understand we're going to look at everything. And I'm going to talk to you about everything on this video. We're going to tell you everything that we do. So let's get started. The metabolic care. This is the first thing that we do. We're going to talk about metabolic first. The metabolic care, a couple things we're going to do. We need to run a complete metabolic panel. We need to run a lipid panel. We need to run a complete blood count with auto differential, separates the white and red blood cells out. We need to run a thyroid panel, but we need to run an extensive thyroid panel. We need to run all of your thyroid markers. We need to run free T3, free T4, your T3 uptake. We need to look at your thyroid antibodies, okay? Now, at this point, a lot of people that are watching this video or talk to me when they come in as a patient will say, well, Doc, I've already had all this testing. My doctor says that all these tests are normal. But they're most likely not normal. And in fact, I would probably guarantee you that they're not normal. Here's the reason. Medical doctors look at lab ranges. Lab ranges are extremely broad and they're very inaccurate. So when you look at your blood work, on one side you've got all your range, all your figures or all your values, and on the other side you have these ranges. These are laboratory ranges. The laboratory ranges come from all of the people giving blood work. If you go over to Quest and you look at people giving blood work, there's some pretty unhealthy people giving blood work. So you're the average of all of the people giving blood work. So they're inaccurate, they're too wide. We use what's called the optimal or the functional lab values. They're more sensitive to find problems in your metabolism and in your internal functions. And the way these figures are come up or brought about or studied is that's the average of all the people without disease, without symptoms, and without all these issues. And so it's optimal. And you want to be optimal if you are trying to prevent Alzheimer's disease. Okay? So this is why your lab test can be normal and you could still be sick, you could still be not feeling well, you could still be not doing the best you can for your Alzheimer's disease. Here, I'll give you an example. Let's just look at glucose. Glucose, the functional range for glucose is 85 to 100. That's optimal. If you look at the laboratory ranges, it's 65 to 110, a lot broader. That means you could be at like 110, which is out of the functional range. 127 is diabetes. That means you're moving closer to diabetes, but you're not quite diabetes. It's called insulin resistance. Or you could be at like 66 or 67, and that's what's called reactive hypoglycemia, or not enough blood sugar. Well, your brain needs sugar, right? And so your brain needs that. People with hypoglycemia have poor brain function, okay? So we want to look at your functional ranges. The other thing we run is what's called an adrenal stress index. An adrenal stress index is going to measure and see how the adrenals, which are the glands right above your kidneys, how they're functioning. Your adrenals are your stress glands, okay? Your adrenals secrete cortisol. And so we can look at, it's a salivary test, and you do it 4 times a day. We can see your cortisol levels at different times of the day. In the morning, your cortisol levels should be higher. At night, they should be lower. And we can determine and see if that's happening. Some people have absolutely no cortisol levels at all. They're so fatigued from so much stress in their life that their adrenals are just shot. Other people have too much cortisol, way too much cortisol because of too much stress in their life. Now, cortisol is toxic to the hippocampus. The hippocampus is in your deep medial temporal lobe. It is the part that first starts to degenerate and starts to develop plaques in Alzheimer's disease. And so if you have high levels of cortisol, it's affecting the memory part of your brain. And so people with high levels of cortisol for a lot of years have decreased brain function in their temporal lobe. Well, that's exactly the area that Alzheimer's starts. Okay, so it's important that we look at that. And we can run the adrenal stress test. It's got to be normal if you're going to have as optimal brain function as you can have. We're going to run sensitivity testing, food sensitivities. We're going to test you for the big 5. We're going to test you for gluten, casein, eggs, soy, and yeast. A lot of patients that have neurological problems and have Alzheimer's and things like that are very sensitive to foods. When you eat gluten, it can create what's called an autoimmune response in your body because your body can be sensitive to it. We can run a test to find out if you're genetically sensitive to gluten. If you are genetically sensitive to gluten, it can not only cause you to have different effects in your body, but one of the biggest things it creates is neurological problems and brain inflammation. You don't want to have brain inflammation if you're trying to prevent and trying to slow down the process of Alzheimer's disease. Does that make sense to you? It's very important. So we need to run these tests. Now, I always get this point. People will say, well, Dr. Childs, I went to my doctor. He ran the celiac test. Now, here's the thing you have to understand. The only time doctors run celiac tests is if you have intestinal problems. Now, it's been studied that people with gluten sensitivity, only like 10% of them have intestinal problems. One of the biggest things that we have with gluten sensitivity, and this has been studied by Journal of the American Medical Association, this has been studied by prestigious journals, what they found out is that gluten sensitivity, the biggest effect is on the neurological system. It's because it creates an autoimmune response. And the celiac test that they do is only sensitive enough to pick up a genetic celiac disease. It won't pick up just gluten sensitivity. So it's very important to understand that. Your doctors that runs only the blood test for celiac, it's not specific enough. It's not sensitive enough. So we need to run a stool sample to find this out. Sensitivity testing. Now, one way you can tell you have a really good chance of being celiac or having a sensitivity to gluten is if you got chronic pain or fatigue, frequent indigestion, fullness after meals, bloating after meals, maybe frequent loose bowel movements, constipation, you vomit often, or you may have none of that. And your gluten sensitivity or your milk sensitivity is affecting just neurological function. Very important to understand. We need to run an intestinal permeability test to see if you have a leaky gut. Very important for you to understand. You've got multiple barriers in your body that separate you from the outside world. You have the respiratory barrier. You've got the skin barrier. You have the blood-brain barrier. You also have the intestinal blood barrier. So as you eat food, what's supposed to happen is your food is supposed to be digested from big molecules, like let's say proteins, down to peptides, down to amino acids. And what's supposed to happen is the gut is supposed to be only permeable to the smallest of molecules so they can get through and they can nourish your body. But what happens is if you have high stress in your life, or if your adrenals aren't functioning good, or if your blood sugars are way off, if you have diabetes, or you have insulin resistance, or you have problems with your intestines, what can happen is your gut can become leaky. And you may not even feel this as stomach pain. But what happens is now these whole protein molecules or peptides get through the gut. Okay? Your gut should be like a screen door. The only thing that should get through the gut is the screen door is air, right? The bugs should stay out, and that's the way your gut should be. But if your gut is leaky or too permeable, what will happen is the amino acids will get through, but not only will the amino acids get through, the peptides will get through. Now your immune system is looking for foreign proteins in your bloodstream, and what will happen is that it may come upon this protein molecule that got through too big, and it thinks it's a bacteria, it thinks it's a virus, it thinks it's something it needs to attack, it thinks it's cancer cells or something like that, so it starts attacking it. But the trouble is, it's a case of mistaken identity because it's just food, it's gluten, or it's casein, or it's some other protein molecule, and bam, now you develop an autoimmune response. Autoimmune means self-attack. And so what happens is if you continually eat this stuff that you're sensitive to and it's getting through your leaky gut because you have poor health, you have this constant attack that your immune system works on. Well, eventually your immune system starts getting used to killing these proteins. It starts getting too strong or out of balance, and it starts attacking maybe your brain tissue, or it may start attacking your thyroid, or it may attack your joints, as in rheumatoid arthritis. And that's an autoimmune disease. So we need to test you for an autoimmune disorder. We need to find out if you have an autoimmune disorder causing brain inflammation. Right? They've done studies on gluten and Alzheimer's disease, and they found that you have a higher incidence of Alzheimer's disease if you're celiac. And that was just celiac. If you're gluten sensitive, and you can look at that and say, well, if there's celiac disease has a higher incidence of Alzheimer's disease, well then somebody that's gluten sensitive would also. And it's because autoimmune disorders cause brain inflammation. Many researchers feel that Alzheimer's is an autoimmune disorder that affects the brain. Now, you may have a genetic predisposition, but if you have autoimmunity and you have cortisol levels that are off, bam, you're going to express those genes faster than the average person. Okay? We're going to run immune panels. We're going to run T and B lymphocytes. We're going to run cytokine panels, natural killer cell activity. We're going to run interleukins. Interleukins are the cytokines that create inflammation. We can look at that to find out what's going on with your immune system. There's two parts of your immune system. There's the Th1 on one side and the Th2. Th1 The way we measure Th1 is to find out if you have high levels of interleukin-2 or TNF-alpha, which is tumor necrosis factor alpha. And Th1 is your T cells. Your T cells attack any foreign invaders. They attack the gluten. They may attack, in a normal functioning immune system, they should only attack bacteria and viruses so you stay healthy, and cancer cells. Right, so that's Th1. Th2 are your B cells. They don't do any attacking. They're not like the army out there that does the attacking like the T cells. But the B cells create antibodies. Okay, and so the antibodies tag and tells the T cells what they should attack. And that's interleukin-4 and interleukin-10. We can test them by those cytokines, which are inflammatory mediators. We need to see if you have Th1 or Th2 if it's in balance. That's a normal functioning immune system. If you have a Th2 dominance, or excuse me, Th1 dominance, then that's an autoimmune disease. Or if you have a Th2 dominance, that's an autoimmune disease. And autoimmune diseases can be classified as Th1 or Th2 dominant. Okay? We have to find out if you have an active antigen or do you have immune dysregulation. Okay? Active antigens mean that your immune system is trying to kill something. Do you have a parasite? Do you have bacteria? Do you have viruses? Do you have parasites, or do you have dysbiosis in your gut? Do you have too much yeast in your gut? Do you have any fungi, protozoans, foods, chemicals like do you have excess aluminum? Do you have excess lead? Do you have excess mercury? Heavy metals, things like that, like what I just named. But food is one of the big ones. We got to test it. That's why we have to do the food sensitivities, because the food sensitivity can be an active antigen causing brain inflammation. The best indicator if you have an active antigen is the CD4-CD8 ratio, which is the helper-suppressor ratio. If it's above 2.5, there's a very high likelihood that your immune system is trying to constantly attack something or try to get rid of something. If it's below 2.0, it's probably immune dysregulation, and that means you have an autoimmunity that is secondary to either anemia, poor thyroid function, diabetes, or high blood sugars, or low blood sugars, or excessive cortisol, just poor metabolic function. Okay? We need to run a DNA stool ecology profile, which is going to let us know, do you have any parasites, which can be antigens? Do you have, from years of antibiotics and things like that, do you have a lot of yeast buildup and low amounts of healthy bacteria? So we need to run that. We can also do a test for H. pylori. H. pylori can be an antigen in your upper digestive tract. We can check you for brain inflammation, or check you just for general body inflammation through homocysteine and C-reactive protein. Very important markers, not only for cardiac, but also for autoimmune issues. We can run neurotransmitter testing or do neurotransmitter surveys. Patients that have Alzheimer's disease may have some troubles with their neurotransmitters, so we can check you to see if you need GABA support, do you need dopamine support, serotonin support, and a lot of times, again, patients with Alzheimer's will need acetylcholine support because that's such an important part of the memory aspect of your brain, the hippocampus. We can run hormone panels to see if your hormones are off, female hormone panels, male hormone panels, things like that. But I'll tell you what, the number one thing we got to check for is this autoimmune and these food sensitivities. It really trumps everything. Now, once we find out and we get this whole metabolic picture as to what's going on with your insides, are you healthy as you need to be, then we're going to set up and say, listen, you need to be on this specific nutritional protocol or this nutritional diet to eliminate any of these sensitivities. And once we find this out, if you have autoimmunity, we need to get you on specific types of nutritional protocols that are going to regulate your immune system, that are going to create that Th1, Th2 to come into balance so we can decrease the inflammation in your body. Right? That's basically what we do. So we use specific types of supplements, non-drug supplements. These things do not react with the medications that you're currently taking, and they're very specific into getting your inner functions better so we can prevent or slow down the Alzheimer's. Okay, so that's what we do. The other thing we use is what's called glutathione. Glutathione is a very powerful antioxidant. And basically what it does is it really protects you from all these outside things like heavy metals and things like that, and it also really regulates your immune system. Very important. So the question is, have you had all these tests? Okay. You're standing here right now, it's either you or a loved one has Alzheimer's disease, and you're concerned because you know what happens with Alzheimer's disease. I mean, it's a sad state of affairs. And the question is, are you doing everything you can? Have you had all these tests? Now, the thing is, you haven't had all these tests. And the reason why you haven't had all these tests is because I can guarantee you that your medical doctor is not looking for this stuff because they're not trained in functional medicine and functional neurology. Their training is in just giving you the specific medications for your disease, but they're not trying to affect you from an alternative or from a nutritional or from a neurological perspective without drugs and surgery. They just don't do it, so they don't run these tests. In fact, if you write, a lot of patients will say, well, can I just get my medical doctor to run these tests? Your medical doctor isn't going to run these tests because they would have done it already. Right? They don't know about these tests, typically. So let's talk about the other side. We just talked about the metabolic side. Now we're going to talk about the neurological treatments based on specific neurological testing. So we need to look at which part of your brain isn't functioning well. We can do a specific functional exam. We can look at the frontal lobe. We can look at the parietal lobe, the temporal lobe, the occipital lobe, the cerebellum, and the brainstem. We can do specific testing to find out what's going on. We call it our comprehensive neurological testing from a functional perspective. We're going to look at blood pressure from the left side to the right side. If you have decreased function of your right brain, you may have higher blood pressure on one side. We're going to look at your tissue oxygenation to see if you're getting enough oxygen. Are you perfusing your are you moving blood flow out to your extremities? Are you getting blood flow to your brain at 100%, right? We're going to look at heart rate and rhythm. We're going to look at salivary pH. That'll let us know if your oxygen levels, things like that. We can look at reflexes. We can look at eye tests. We can do very specific eye tests where we measure your eye movements. We use a infrared camera to look and see where some of the decreased function is in your brain. We can do cranial nerve tests, which is the nerves that come off the brainstem. And we can run cerebellar tests. The cerebellum is a very important part. It controls your posture and controls your balance and your coordinated movement. A lot of people with Alzheimer's and neurological issues will have decreased function in their cerebellum. We need to look at that. So we're going to look at a specific part of your brain. Specific parts of your brain control specific areas. Up here in the middle part controls your legs. As we come down here, it's your face. And it's called the homunculus. We can look at that. We can see which parts of your brain is not functioning well. Again, your nerves require two things, fuel and activation. We talked about fuel. And so none of the neurological work works without proper fuel. So we got to get fuel to better. But now we're going to talk about the activations that we do. One of the things that we do is we do oxygen therapy. We put all of our patients, when we do exercises, whether they're specific brain exercises, specific brain stimulations, we put them on oxygen because your brain needs fuel and activation, and fuel is oxygen. So we do EWOT, which is called exercise with oxygen therapy. Now, I was just reading Newsweek probably a few months back, and right on the cover of Newsweek, they talked about how exercise can prevent Alzheimer's disease. And the reason why exercise can prevent Alzheimer's disease and prevent depression is because when you move your body, you stimulate receptors, and those receptors fire the brain. The more you use your brain, the more you create neuroplasticity, which means better brain function. If you combine moving and exercises, we'll put patients on an upper body ergometer while they're breathing oxygen, it fires the brain, and then it forces the brain to repair itself. Oxygen concentrators. We use 95% pure oxygen. We do it while you exercise. It activates the cerebellum and it provides fuel and oxygen. We don't use tanks. We use concentrators. It brings it from 20% to 95%. We're going to use specific brain-based therapies. We're going to use something called an interactive metronome. An interactive metronome is, and this lady here is using it. We put these headphones over your ears, and you're going to listen to a reference sound. And what's going to happen is you need to hit it right exactly on the reference sound. And you've got visual cues, you've got auditory cues, and you have to use gross motor. And so that is a huge thing that we use with stroke rehab. We use it with our kids, and we use it with our patients with early Alzheimer's. We can do eye light therapy. Eye lights from the left will stimulate right brain. Eye lights from the right will stimulate the left brain. We can use something called a HemiStim program. The HemiStim program is a TV that you look at that has eye exercises with specific types of lights that stimulate your brain. We can use the Rebuilder, which stimulates peripheral nerves. And these are some of the things we do. So some of the goals of the interactive metronome is to drive neuroplasticity and to improve mental function and improve timing. It improves the brain's efficiency and performance. This has been studied, okay? IM will improve auditory processing, short-term memory, working memory, processing speed. What we'll see with patients with early Alzheimer's disease is their processing speed goes down. Cognitive resources, executive functions, motor coordination, sensory processing. IM impacts mental and interval timing structures of the brain, which is different parts. These are big words. It affects the frontal lobes, the dorsolateral prefrontal cortex. It affects a part of your brain called the basal ganglia, the cingulate gyrus, and the cerebellum, which are all parts that eventually will be affected as your Alzheimer's spreads. We can use, again, we talked about oxygen therapy, vibration therapy, gentle neurological adjustments. When you adjust the spine, what it does is it stimulates the brain. Okay? You are a receptor-driven creature. Now, what do I mean by receptor-driven? Well, let's say I put a cast on my hand. If I put a cast on my hand or my arm, and then 6 months later I took the cast off, what is my arm going to look like? It's going to look all thin and brittle and white and things like that. And the reason why is because I didn't move it. I didn't move the receptors. So what happened was my arm atrophied. Well, they've done studies. If you keep that on, if you kept that cast on for a year or even longer, not moving, what will happen is the part of your brain that controls your arm will also shrink because it's not being activated. So the receptors that are in the joints and the muscles activate the brain. And that's what a chiropractic adjustment does, is it stimulates the joints in your back, which are really heavily laden with these receptors, and it fires the brain. Okay, so if you have bad right brain function, we can adjust the left side. Bad left brain function, adjust the right side. We don't have to use manipulation. We can also use an instrument that kind of vibrates and moves the receptors. We can use vibration therapy like we talked about. We can use warm water calorics, which stimulate the cerebellum. A lot of balance therapy. What will happen with patients with Alzheimer's is they're going to really start to lose their balance over time. We can use auriculotherapy. Olfactory stimulation is smell. Most people with Alzheimer's will lose their smell. And the reason why they lose their smell and they'll lose their taste along with it is because the smell centers are in your temporal lobe. And remember we said the temporal lobe is the first part that degenerates and loses function in Alzheimer's disease. So we want to use a lot of olfactory smell stimulations to keep that part of your brain active. Okay. We can do colored lenses, we can do mazes and word searches, and a lot of this stuff we get you doing at home. Sounds of certain frequency, music therapy, which is very stimulating to the temporal lobes. All these types of things. Okay. A lot of people with Alzheimer's disease, and as it progresses, they start to get posture that goes forward like this. And so we want to do spinal care that improves the extension so they start to stay straight. We want to really strengthen all the muscles in the back of their spine and the cerebellum to improve extension, because we don't want you to start to get posture like this, right? You look at somebody with late Alzheimer's, they're like completely hunched over because the brain controls extension. Good brain, good extension. Bad brain, like this. So we want to really improve that. And we also do decompression, because as you start to lose spinal structure, you start developing disc problems in your back. And so a lot of patients with Alzheimer's also have herniated and bulging discs, and so we want to improve that with our decompression therapy. But we also do that with oxygen because that stimulates the brain. We also do biomechanical spinal correction. So again, as I talked about, is patients with Alzheimer's, they tend to get this forward head posture, right? And the reason why they do is because their brain isn't functioning well. So we'll take x-rays, a pre-x-ray. This is the person where the person should have been, and this is where they were. So you can see they went forward 52 millimeters. And after a course of care, we re-x-rayed them, and now they're normal as their brain function improved, and as their cerebellar function improved, and as their spinal function improved. We restored the arc in their neck. And that can really pay dividends for somebody that's starting to really go forward because of poor brain function. All right, so here's a couple questions. I want you to think about this. I'm going to read these to you. How has your Alzheimer's affected your relationships, your family, your finances, or other activities? I mean, how's it affecting your life? I'm sure if it's early right now, or your loved one, is watching this, you're really concerned about how things are going to be in the future. And the question is, are you doing all you can to slow the process of brain degeneration down? Now, you may be doing the medical treatment, the drugs, and things like that. That's great. But are you stimulating your brain? Do you have a functional neurologist that's finding out which parts of your brain need to be stimulated? Are you looking at all the metabolic factors? Probably not. Okay. What has your Alzheimer's cost you in time, money, and happiness? Well, and sleep. It's worrisome to think that you could get to a point of having zero brain function. I mean, you could lose all your faculties. Okay, so think about that. Where do you picture yourself in the next 3 to 5 years if you do not do all you can to prevent the progression of your Alzheimer's? Now, I'm not sitting here telling you right now that you're not going to have progression, but you got to slow it down. You want as much quality of life that you can muster up. And if you're only doing medications and that's it, and you're not looking for all these other things that we talked about today, then you're not doing everything you can. Okay? And so that's basically it. That's all I want to talk about today. If you're watching this video online and you would like to come in for a consultation, you can put your name and information in, and we can send you information on what a a consultation would be and how you could come into the office and do that. If you've already come into the office and you had a Alzheimer's functional neurological exam and you're waiting to come back in for your report of findings, make sure you watch this video. Make sure you read everything in the booklet that we gave you and in the folder that we gave you. Make sure that both your spouse and you watch this. Any one of your loved ones that are interested in this, make sure they watch this and then bring them back to the report of findings, and I will sit down and go over what I think would be best to help you with this concern. Okay? So thanks a lot. We'll see you when you get back into the office.